This module describes the anatomy and developmental changes of both the upper limb or median nerve SEP and the lower limb or posterior tibial nerve SEP. The SEP recording tests the integrity of the sensory system from the wrist to the brain in the case of the median nerve SEP, or from the ankle to the brain for the posterior tibial nerve SEP. Both the median nerve and posterior tibial nerves contain sensory and motor fibers, but we're testing the integrity of the sensory or afferent fibers. These sensory fibers carry specific input about touch, pressure, vibration, pain, temperature, etc. However, when we stimulate, we attempt to stimulate a majority of the fibers. So we stimulate with a high enough intensity that we can confirm that we are stimulating most of the sensory fibers by applying a voltage that's high enough to activate the motor fibers. When we see a motor twitch at either the thumb for the median nerve or the big toe for the posterior tibial nerve, we'll know that we've activated the motor fibers, and then we are sure that we've activated the majority of the sensory fibers as well. We'll talk more about stimulation in the module on practical aspects of SEPs. In the next slides, we're going to look first at the median nerve and then the posterior tibial nerve SEP. The upper limb SEP is generated by stimulation of the median nerve at the wrist. The median nerve, shown here in yellow, receives input from the palmar surfaces of the thumb, the pointer and middle fingers, and a portion of the ring finger. It passes across the palm and up the wrist, passing between the tendons of the palmaris longus and the flexor carpi radialis muscles. Because the median nerve innervates the thumb and some of the intrinsic hand muscles, application of high stimulation may result in movement of the thumb plus some of the fingers. We will talk more about the location of the stimulator and stimulation parameters in the module on stimulation. The median nerve ascends the arm through the wrist and carpal tunnel and up the forearm. It wraps around the top of the forearm on the outside of the elbow, travels through the cubital fossa to continue ascending up the inside of the upper arm. The median nerve passes through the armpit or axilla and then joins the brachial plexus. The brachial plexus passes behind the collarbone or clavicle, and it is a network of nerves formed from cervical nerves 6, 7, 8, and sometimes includes 5, as well as thoracic nerve 1. These nerves enter the spinal cord at this point. This is an enlarged diagram of the path of the SEP from the brachial plexus at the bottom, where the SEP signal enters the spine at the dorsal nerve root and travels up the dorsal column. At the cunate nucleus of the medulla, it crosses over and continues up the medial lemniscus to the thalamus. At the ventro-posterior lateral nucleus of the thalamus, or VPL nucleus of the thalamus, it enters the brain via the thalamocortical tracts. The pathway ends at the sensory cortex. Because the pathway crosses at the cunate nucleus, stimulation of the median nerve results in an SEP on the contralateral cortex. Starting at the bottom again, I will talk about the waveforms generated by the various anatomical structures. For the median nerve SEP, the first waveform is the N9. This is a peripheral response, and it's generated outside the spine and central nervous system, and it's generated by the brachial plexus. The next responses, the cervical responses, the N12 and N13, are generated by travel up the dorsal column and activation of the cunate nucleus, respectively. The N14 and P15 are generated by travel up the medial lemniscus and activation of the ventral-posterior lateral nucleus of the thalamus. Travel through the thalamocortical tracts generates the P16 and P18, and finally, activation of the sensory cortex generates the N20 and P22. This is a view looking at the left side of the brain, with the front of the brain on the left side of your slide. The sensory cortex is colored orange and is located on the postcentral gyrus, just behind the central sulcus. Just in front of the central sulcus, on the precentral gyrus, is the motor cortex. Because this is the left hemisphere, stimulation of the right median nerve would generate a response in this hemisphere. If we were able to slice the brain at the thick black line, which is approximately where the central sulcus would be, and if we could open up the brain and look at the coronal slice, you will see this on the right side of your slide. So this is a coronal slice of the left hemisphere, looking at the post-central gyrus. The motor and sensory gyri are organized in what's called a homuncular fashion. This means that the major controls for the different body parts are organized in the approximate order of the body. The leg and foot regions are located within the longitudinal fissure between the two hemispheres, located near the vertex or the top of the head. The hand area is about halfway between the vertex and the temporal fissure at approximately where electrodes C3 and C4 would be located. Moving now to the lower limb SEP, which is obtained by stimulating the posterior tibial nerve, or PTN. The PTN nerve innervates the intrinsic muscles of the foot along the sole of the foot. Shown in yellow in this picture, the posterior tibial nerve passes posterior and inferior to the medial malleolus, which is the bone that juts out on the inner side of the ankle, and then the posterior tibial nerve continues upward. After the ankle, the posterior tibial nerve continues upwards, deep within the muscles of the lower leg, behind the bone of the tibia. At the knee, the nerve becomes more superficial, crossing the back of the knee at the popliteal fossa, and then joins other nerves to become the sciatic nerve. Although within the sciatic nerve, the posterior tibial nerve component is the largest component. The sciatic nerve then enters the spinal cord between L4 and S3. This is again an enlarged version of the brain and spinal column. The posterior tibial nerve SEP signal travels through the sciatic nerve at the bottom of this diagram and enters the spinal column between nerve roots L4 and S3, which is located in the lower back. It travels up the spine and follows the same pathway as the median nerve, ascending through the dorsal column to the medulla. Instead of synapsing at the cunate nucleus, which was the case for the median nerve SEP, the posterior tibial nerve SEP synapses at the gracile nucleus before crossing over and continuing up the medial lemniscus to the thalamus and eventually to the sensory cortex. Recalling the homuncular organization of the cortex, this means that the leg control area that's captured by the posterior tibial nerve SEP is located at midline because the leg area is within the longitudinal fissure at the vertex of the head. So a right posterior tibial nerve stimulation would result in activation of the left sensory cortex, although both left and right sensory cortices are captured at CZ. The first recording electrode for the posterior tibial nerve SEP is placed at the popliteal fossa to capture a peripheral response, the popliteal response. The next set of recording electrodes are located over lumbar spine and capture the entry of the response through the nerve root into the dorsal column. This generates the N18, P21, which are the lumbar responses. Finally, a recording electrode is placed over the vertex to capture activation of the sensory cortex near the leg area. The development of the SEP follows a complicated pattern of changes as the child grows in size, which increases the travel time of some of the signals, resulting in longer latencies, and at the same time, as the child matures, their nerves become better myelinated, and therefore the signal travels faster and results in decreased latencies. For example, the peripheral responses reflect the travel time through the periphery, either from the wrist up the arm to the brachial plexus, or from the ankle to the knee for the popliteal response. In both cases, as the child grows taller, these limbs usually grow longer and the latency of the peripheral responses increase. With regards to the cervical responses, which are the N12 and N13, seen as the little W morphology marked by the arrows in your figure. The N12 decreases in latency until approximately 2 years of age, and this reflects the myelination of the nerves. After this age, the N12 begins to increase in latency as a function of arm length. The N13 shows a similar pattern, with a decrease in latency initially until approximately 2 to 3 years of age, and then it starts to increase in latency as a function of arm length. Not shown in this picture, but following the same pattern, the posterior tibial nerve SEP lumbar responses show exactly the same pattern of decreasing latencies within the first few years of life as a function of maturing myelination, and then increasing latencies as a function of increasing leg length. Moving to the development of the cortical components. Not all of the cortical components of the SEP are observable in neonates. The peaks within the SEP are not as well delineated due to poor myelination and poor signal summation and conduction to the surface of the scalp for recording. But as early as 27 weeks gestational age, the P16 and N20 are observable, although the P16 is often of low amplitude. The N20 is the prominent negative going peak that is observable and is usually the most prominent peak seen in a preterm recording. At term, the P22 becomes observable, and at this age it's possible to see a P16, N20, and P22 complex. And usually at this age, the most prominent peak is the positive going P22. As mentioned in the previous slide, the N20 is observable at approximately 27 weeks gestational age, although the latency is often very prolonged, reflecting the poorly myelinated nervous system of the preterm infant. As the infant matures, the N20 latency decreases until approximately 3 years of age, at which time the latency starts to increase as a function of limb length. The P22 is observable at term and decreases in latency until between 6 to 8 years, reflecting maturation of the myelin, and then begins to increase in latency as a function of limb length. The subcortical components are deeper and more difficult to see. The N18 becomes observable around 3 to 5 years, and the P16, P14, P16 components are observed as one P16 peak until about 6 to 8 years, and then it begins to split into the two separate components of the P14, P16. The posterior tibial nerve SEP follows the same pattern of decreasing latencies initially as myelination matures, and then increasing latencies as a function of increasing leg length. A few last notes about the development of the SEP. SEP stimulation is generally better tolerated in children and infants than in adults, because the nerve fibers, which include the pain fibers, are not as well myelinated. Therefore, children are less likely to complain of pain or extreme discomfort during SEP stimulation. The SEPs recorded are often of larger amplitude and clearer morphology in children than in adults, as the cervical and cortical recordings are near-field recordings. Children often have less fat around the neck, and their skull bones are thinner, allowing for easier conduction and easier recording of the SEP primary components. Finally, of the three EP modalities, the auditory, visual, and somatosensory evoked potentials that are typically recorded, the somatosensory pathway is the longest in length and takes the longest to mature. Therefore, it is absolutely critical that one be aware of the age of the patient when interpreting the tracings.